Bringing change to the Pacific Islander community. To ensure the health of a population is well maintained, vulnerable population groups that are facing health inequalities need to be identified. This will allow for health strategies to be implemented. Therefore, in this executive summary, Pacific Islanders are a chosen vulnerable group to discuss the health inequalities that are present within a community. To address the health needs of the Pacific Islanders, a community empowerment approach will be made. Firstly, a more specific identification of Pacific Islanders and the reason for the presence of the poor health outcomes will be conveyed. Secondly, the relevant policy gaps and how they were created will be then explained. Finally, this executive summary will deliver a detailed strategy to empower the vulnerable group and key tactics.
I'm going to be identifying the population and providing evidence of the poor health outcomes. The population we chose is the Pacific Islanders, which is a population who are from one of 26 countries, whether they are born overseas or they have ancestors who migrated to Australia. The 26 countries are organized into 3 categories, which include Melanesia, Polynesia, and Micronesia. The group is vulnerable to health inequalities such as diabetes and obesity due to the cultural beliefs, which can also be factored into excessive eating. Food is a cultural necessity for Pacific Islanders as it allows their families to bond together, especially during important events such as weddings, holidays, graduations, and funerals. Although the older generation of the vulnerable group is difficult to convince due to preferences in their culture, the younger audience are more influenced by the healthier options of cooking food. This is so that they could prevent any development of chronic diseases within their families. Although the Australian national data does not specify obesity levels in Pacific Islanders, the National Health Survey recorded 63% of migrant adults born in the Oceania region are overweight or obese. Majority of the Pacific Islander population is settled in the state of Queensland, and the data implies that Samoan-born groups are 7 times more likely to be hospitalized. Cook Islanders are 9 times to be hospitalized, and the Tongans are 5 times to be hospitalized. In addition to their poor health outcomes, their population experiences low health literacy, and that the group rely on their social group for assistance rather than health services due to reluctance, embarrassment, and fear. In the next section, I'm going to allow Omar to speak about the policy gap.
Thanks, Aaron. In the context of the health inequities affecting the Pacific Islander population, the relevant policies that have created a policy gap are the Australian National Diabetes Strategy and the Health Literacy Framework. The diabetes strategy has failed. The prevalence of self-reported diabetes in Australia has stagnated from the years of 2014 to 2018. The Diabetes Initiative does not disclose any plans of improving the diet by addressing their adoption of the highly processed Western diet after migrating to Australia, which is a significant factor for the obesity and diabetes issues in this population. Another significant factor which facilitates the high levels of obesity within the Pacific community is the integration of food and feasting in their culture. Families are expected to supply exorbitant amounts of food as it reflects their health, wealth, and well-being. This further exacerbates the situation. The Health Literacy Framework of Sydney has not been able to effectively dispense health literacy information to the Pacific Islander population in Sydney. Southwestern Sydney Local Health District reports that the Pacific population has a taboo against discussing sexual and mental health, even with Pacific doctors. This leads to reported conditions developing without medical attention and is another example of a policy gap that has not been addressed. In conclusion, the services available are general services that are not culturally responsive to the Pacific community in Sydney. I'll now hand over to Mariam.
This can see through policy change and addressing the health issues among community Pacific Islanders. Working with communities can seen in a way to empower people and influence decision making. It is evident that individuals that identify as Pacific Islanders have poorer health outcomes and are challenged with accessing services. It is important to develop strategies that reduce barriers and promote access to health services among Pacific Islanders. This can be seen through introducing policy change such as public health initiatives and cultural influences that would help create policy change, as they are heavily influenced by Pacific Islanders as it plays a huge role in the community. Developing strategies such as culturally tolerant programs and resources will allow individuals to feel understood, accepted, and acknowledged. This strategy will promote Pacific staff and healthcare workers that are from the same culture or individuals that are extremely experienced throughout this culture group. By improving the response and promotion of culture, this will ensure that individuals are less reluctant in accessing services, which can result in reduced barriers and better health outcomes for individuals who identify as Pacific Islanders. These tactics and strategies can be seen through the next slide, which Ijam will expand on.
Thank you. Tactics such as working with community leaders, such as pastors and church elders, is important as Pacific Islanders' beliefs and health perspectives are majorly influenced by the leaders and pastors through church. To continue that, ensuring cultural competency trainings are available and undertaken by staff and health professionals often will ensure cultural competency amongst all staff. Obesity is a major health concern for Pacific Islanders. Introducing cooking classes that will teach individuals how to cook healthier foods that are run by individuals who identify as Pacific Islanders as well will further help improve individuals' perspective on food. Moreover, introducing cooking classes will educate individuals on better foods, food options, healthier dietary sources, and alternatives by individuals from the same cultural background may have a positive impact on individuals' health and reduce obesity rates amongst the Pacific Islanders. Poor health outcomes among Pacific Islanders are impacted from both health system complications such as poor health literacy, barriers in accessing services, and the need for improved culturally responsive health services, as well as broader social determinants of health, such as economic and educational disadvantages and exclusion and isolation. By improving the response and promotion of culture, this will ensure that individuals are less reluctant in accessing services, which can result in reduced barriers and better health outcomes for individuals who identify as Pacific Islanders.
As seen, the main reason for why the Pacific Islanders' health is lower than the rest of the population is due to cultural beliefs and views. Just like many migrating cultural groups in Australia, it is often difficult to successfully implement and maintain health strategies. This is because of the difference in the way health is viewed. As mentioned, the younger generation are more understanding of the need for change in diet than the elders. So it is only best for policymakers to include community elders in health strategies. Furthermore, both Australian national diabetes and the health literacy strategies will need to assess health needs of the population group and provide suitable programs to reduce the number of diabetes and introduce health literacy programs. This will allow a change in health inequalities.